90% or more of Americans in particular are metabolically unhealthy. And we have available technology that's affordable, that is very well suited for detecting, preventing, and managing optimal metabolic health before metabolic health becomes a problem. So the quicker we get ahead of the problem, then that'll pay big dividends when it comes to preventing what is a healthcare crisis right now.
Do you eat like chickpeas and stuff, or you try to?
Yeah. Mm-hmm.
You're not like religious about keto stuff?
I'm like just low carb, and some days very low carb to where like I'm producing ketones, but I also use supplemental ketones. So on those days, so I usually take like 2 packets. My wife has a company, Audacious Nutrition, so she makes it's Element, the same elements as Element, but the ketones are bound to the elements. So it's electrolyte supplement. So I just drink that, and it gives like the electrolytes and the ketones, and yeah.
What do you do for carbs in a day? Like how many grams are you hitting?
Yeah, I usually I have probably like 3 or sometimes 4 servings of fruit, usually berries, an apple, an orange, and we have mango trees. We have avocado trees on our farm, so we have lots of stuff. So, but usually it comes out to about 70 grams a day, and I have
70 grams
broccoli every day. But a third of my carbs are like at least fiber. So if we're going to talk about net carbs, like always under 50 grams per day. And some days I'm active, but most days I'm pretty much, just in the lab working or at the desk. So I'm not really burning that.
How you're crushing those mangoes. Like, cause when I've seen you did that experiment last year when you had like a couple of them. Yeah, and they're just because it's for me, when I eat mango, I could have like, we'll buy the like frozen chunks for smoothies and stuff, and the kids like them, but I can't eat like mango or banana or anything without I eat like one little morsel, and it's just like to the moon.
So if I get it and it's kind of tart and somewhat crispy, like just starting to get sweet, but like a little bit tart, it has like almost no response. And then if I let it sit for like 5 days and it gets mushy and super sweet, completely different completely different glucose response. So because the starch is breaking down sugar, right? And I kind of like it a little bit crunchy and tart. So it's like a little bit crunchy and like, so that's how I eat them. I grab them, my wife likes them like kind of almost like a pudding, like they're super sweet. But that's like, you would never know that insight without a CGM.
Yeah.
So that's where a CGM is kind of interesting. I think I posted, a ripe one and an unripe one. But the first one, it was like a big one. And I remember it shot up to like 170 or 80, I think, just with a mango. So it was pretty crazy. Yeah.
It's so wild.
Mangoes are like a sugar bomb if you let them get ripe. But if you let them get semi-ripe and just tart, like it's like a 20 and it comes down slow because it takes a while. But everybody's different too.
Totally.
So I think that's what, and that's, my wife will wear a CGM and I'll have a bigger response than she has to many. She eats more carbs, so she maybe has better carb tolerance than me. So, but yeah, that's part of the beauty we could talk about in CGM.
Yeah. It's so wild. I find the same thing too with like when I do eat, in general, like eat lower carb, but I'll eat like lots of beans. So I'll try to eat legumes. So not as much lentils, even though I like them. It's just like honestly just being lazy because you get like chickpeas and kidney beans and black beans all in the can, which is yes, it's better to make them from scratch, but I love eating them, but also try to not go crazy, because if I eat a cup versus like half a cup or a quarter cup, like the difference of my carb tolerance is so there's such a big delta. But I find with fruit, like literally the only fruit I can eat because of being pretty disciplined with and eating a lot of fiber, like I ate tons of psyllium husk and flax and chia, things that try to get that every day, multiple servings of it, and then
that'll attenuate your glucose spike.
And it makes a difference,
a huge difference.
And same with like avocado, usually like half to a whole one a day, and the big ones. But I find that when I eat any fruit other than anything that has fiber in it, like raspberries, blueberries, blackberries, I find it's just like my body can't take. If I eat a quarter of an apple, even if I eat it with almond butter, I'm still my body can't handle it, because it's gotten so used to that baseline of like, oh, you're not giving it glucose, or you're not giving it that carbohydrate to actually use that. So it's wild. It's so wild.
And, you know, if I have, every night I have a cup of blueberries with sour cream. I know it sounds weird. And then chocolate, collagen powder. And I mix it up with, you know, a teaspoon of cinnamon. That's like every single night. Like I'm home, I have that. There's like no, if I have blueberries by itself, big spike. Blueberries in the context of that chocolate pudding, like 0 spike. So I think, you know, and the context is that the glucose is trickling into the system and it's able to be disposed of before, you know, it even elevates in the blood. And I think, you know, there's things that you would never know this if you didn't wear.
You're getting the pairing at that point, so that it's not naked.
Yeah.
You know, the fat and the fat and the protein are wrapping it. Where I think from a digestion standpoint too, like what your body's doing to actually break it down biologically is going to make such a difference versus just. And it's like the dopamine in my brain is going every night after dinner because I won't want to grab something sweet, like I tend not to, but the thing I have to stop myself is like, how big of a bear paw can you grab with, like, out of the blueberry bin? I'm like stopping myself from you're like, okay, that was a pretty big serving, and then my brain is going, go get more. But you know, it's like I'm eating them naked at that point where I'm not pairing them, because in the morning I'll have my yogurt and I'll have things like that. So it's always that balance of like knowing where you're like, you're good, because you don't actually need it. Your brain is going, you need this thing right now, but you don't actually need that from a fuel standpoint, especially after just eating dinner. You know, you just eat this thing and you're like, oh, go do that thing, because the sweet part of your brain is going, do it.
The nighttime eating is something that I've always done, because I would just work all day at college, you know, and I drove to Rutgers University and would come home at 10 o'clock at night, and I would just literally eat till midnight. And I established that pattern early on. And that is kind of what I do now, but not to the extreme. So I do tend to get probably 50 to 60% of my calories, you know, at dinner and after, you know, at least. So, and I do snack at night, but that's where I get all my fiber. I tend to not like to eat fiber during the day, especially with coffee and stuff. It just doesn't settle well. But at nighttime, that's when I have the broccoli, the salad, and then the fiber fruit, you know. But I tend not to eat fiber or carbs, you know, much throughout the morning and afternoon hours.
Yeah, so it's interesting how the body normalizes to a baseline. Like I remember in university, I would come home you'd go out and you'd have a late night, and it was like, whatever time you get home, let's say, it doesn't matter if it's 11:30 or 1:30 in the morning, my brain was always telling me the same thing of like, go make a massive pot of spaghetti with red sauce and like put cheese. I mean, just this like ridiculous portion. And your body absolutely doesn't need that at that time, but you're going, I need this before bed. You know, it's this like silly thing that you do. But I think it's like, as you go through these waves, you normalize to this baseline of like what you end up doing. And I'm not saying that's anything anyone should do at any time, because it's ridiculous. But I think that,
it depends on your goals. If you're trying to gain weight,
true.
Like when I was in college, I was lifting, I would work all day, study, go to the lab, and then I would lift at like 7 to 9, or maybe 7 to 8, and I would come home, and then I would have a huge bowl of oatmeal, protein powder, like 2 bananas, and like other food with that, and would just eat it like really slow. And it's just this was like my weight gainer strategy. If I didn't eat at nighttime, well, just to actually maintain my weight, because I was so busy during the day. With classes and lab work and everything else, that I would kind of undereat. I would just be eating like cans of tuna fish or chicken breast or something like that. And then I would just have to play, you know, nutritional catch-up at nighttime, or caloric catch-up. So I wouldn't be in a deficit. Yeah.
Wild. Yeah, you're always oscillating, I guess, between the bulk and the cut and the bulk and the cut. Yeah. So wild. Why don't we talk a little bit about this idea of this invisible epidemic that's going on? So, what are some of the gaps right now that we all face with this idea of metabolic health, and why is it important that somebody should track things like glucose or get things like blood work, even if they don't think they're air quotes sick?
Yeah, well, we can make, based on the literature, that 90% or more of Americans in particular are metabolically unhealthy. Right. And we have available technology that's non-invasive, that's affordable, that is very well suited for detecting, preventing, and managing optimal metabolic health. before metabolic health becomes a problem, which it is for the large majority of the population. So the quicker we get ahead of the problem, then that'll pay big dividends when it comes to preventing what is a healthcare crisis right now. So that's going to not only make you feel better, look better, check all the boxes on things that are beneficial, but down the line, that is going to, be a preventative strategy. So you could be reactive, as our healthcare system and just health in general is very reactive, whereas the CGM technology allows individuals to be proactive in regard to taking charge of their metabolic health and optimizing it in a way to increase the quality of life, really.
My background's in nutrition. I thought I knew everything, but it wasn't until I was tracking that I had to ground truth my assumptions with what was actually happening in my real life. The only way to actually know what works is real data. Using levels has been life-changing. For one, I've learned how food individually affects me, even though I know as a physician how stress impacts your glucose levels and your cortisol levels. It was very eye-opening to see right in front of me in real data that my glucose levels go through the roof under certain forms of stress. You can see how food, stress, sleep, and exercise impact you personally to make smarter choices that improve your health. With features like AI-powered food logging, real-time blood sugar tracking, comprehensive blood testing, and personalized dietitian support, Levels gives you everything you need to optimize your health. Whether your goal is losing weight, having more energy, or choosing the right diet for you, Levels gives you the full picture of your metabolic health. Stop guessing, start knowing, check out Levels, and click the first link in the description. Now, back to the episode.
When you think about some of these things as it pertains to conditions related to metabolic health, or even let's talk about injury, right? Using sort of a benchmark. I think it's apparent when people have acute injury, like you sprain your ankle, and it's quite apparent that your ankle is sore. There's inflammation, you can feel it, you can see it. But a lot of these chronic conditions take years and years to develop. And so how do you think about it when it comes to metabolic health and this idea of signs and symptoms, right? Like there aren't a ton of signs or symptoms until you have signs or symptoms, but that's sort of a 10-year journey, right? And it could be shorter, it could be longer, but there's this period of time where these chronic conditions, and if you think about it in terms of almost like finance or in terms of the gym, compounding is what gives you gains. Compounding is what gets to some of these chronic conditions developing. It's not a point in time where it's one thing happens. And so how do you think about this idea of people not necessarily having immediate or acute signs or symptoms, but knowing that they're getting to a point that they need to, or they should start proactively taking care of their metabolic health?
Mm-hmm. Yeah, well, metabolic health is on a spectrum, and everybody's, fits at a different place on the spectrum. And I think the data would support the observation that if you randomly just take people and measure their fasting blood glucose level, if we're going to use that, which is not ideal, but basically would show that a large majority, up to like a third of the population, are pre-diabetic. So that's the precursor for diabetes, and they don't know it. So and I think I saw a paper statistics that of the people that have pre-diabetes, who are on the edge of having overt diabetes, something like 80% of those people did not know it. So, where these wearable technologies, continuous glucose monitoring, gives you, my medical students say it's metabolically woke. So gives you the metabolic awareness that allows you to make the change, before it happens. And I think, we are all on a spectrum, and we really don't know of metabolic health, and we would not know where we fit on that spectrum without understanding our glycemic response to food, our baseline glucose, and really most important, the postprandial glucose response in response to a meal, and what types of foods we should be eating and how much to eat. So that is the most critical information to have that we don't have, that we would not have without CGM.
Yeah, the interesting thing too is that you can use that example with glucose monitors or any other wearable technology, or even point-in-time measurements that don't necessarily have real-time tracking right now. But they're almost these analogs when you think about what are the what are some of the top or leading causes of conditions or death, and you talk about things like chronic kidney disease, you talk about people having high blood pressure, and it's the same. The analog is that there is, and I don't want to get into any empirical data because there's lots of literature out there, but we know things like chronic kidney disease, the majority of people who have it don't know they have it. So that's kind of the same analog. Same with high blood pressure. The majority of people who have it don't know that they have it. And so without having proactive measurement for years in advance to monitor things like blood pressure, to look at things that would lead to, like, let's say, EGFR, right, where you're looking at what's the health of kidneys. And I know we're getting a bit off track because there are different ways that you can do that through blood testing, but without knowing that or understanding that, then people don't have the tools. And I think that's the sort of the foundation of metabolic health, is give people the tools so they can get some data to get the baseline of where they stand as it relates to either specific organs or specific biomarkers. And you can give them a bit of a picture, and then you can say something like a biosensor or a glucose monitor. You can say, hey, this is what's happening in your body in real time as it pertains to that one biomarker, and being able to track it is what's going to allow you to have a bit of a window into your overall health. But I think that's the important thing, is that when people have some of these conditions and they don't realize it, that's where you get to that 10-year period that's like, oh, how did this happen? And it's like the chronic compounding over and over. And sometimes you get to a point where you can see it and you can start to do something about it. And I think everyone can always do something about it. Unfortunately, there are times when people get there where it's almost too late. It's too far gone. If you see, let's use something like chronic kidney disease. If you see that your EGFR, something that declines over our entire lifespan, if you see that it's at a certain level, say it's below 60, you're not going to bounce back to be over 100. That's just in decline. So it's important to see the health of your body proactively, so you can go, cool, what can I do about it now to mitigate some of these downstream trends?
Absolutely, because the markers that are typically measured, even EGFR, the kidney function, liver function, and many other just standard markers, when they become a problem that happens over a protracted time frame. And once the problem of prediabetes starts, to avert diabetes, it's kind of prodromal in the way that, it's like a linear progression towards that. And you if you don't get ahead of it, it's hard to course correct along the way. And I think wearable technologies really give you the insight and the metabolic awareness to make what could be, relatively subtle changes to course correct your metabolic health before, for example, you have irreversible kidney damage or other, vascular damage over time, and chronic inflammation too, which is directly a result of, hyperglycemia, glucose spikes that may not be captured, for example, in a fasting blood glucose, and then they could have, consequences for all the age-related chronic diseases. So yeah, managing glucose control and glycemic variability is really like the key for managing like the 4 horsemen of what's going to kill you, right? And how you feel. And I think that's more tangible to many people, right? Tighter glucose control correlates with better, less brain fog, being more alert, and just feeling better throughout the day. And you could subjectively, I know wearing a CGM, I could subjectively even predict what my glucose is based upon how I feel. And that metabolic awareness is really insightful for people. It takes time, but I think, they acquire it over time. And I know, you had that too.
Yeah, it's very visceral. Mm-hmm. It's a very visceral feeling where you can feel what it feels like when your glucose is rising, because you get that sort of warm, tingly feeling, and you can feel that you're maybe a little more elated in your head, and it's this like very visceral feeling where you go, I will guess that and you can get so dialed in when you when you track things like glucose over a prolonged period of time, where you can almost guess how many basis points you are above your baseline, which is really interesting.
Or hypoglycemia, reactive hypoglycemia, which is, I had sushi, or just Chinese food tends to do it. I don't know. It's the sauces that they put or the MSG or whatever, but it'll spike up, and then I'll have the postprandial hypoglycemia where I start to just feel a little bit shaky, and that is something that, I bet my glucose is this, and I'm usually like plus or minus 3 or 4 points close to it, because, and a lot of people don't understand what that is.
Mm-hmm.
They just know they feel crummy, and they don't feel, it's basically limited glucose availability to the brain, triggering a energetic crisis to the brain. And that is not good if you're have to do daily activities, if you're driving, if you're in a situation, any situation really. It's not ideal.
I know I always used to associate, because I think that's what we do naturally as humans,
Mm-hmm.
is you try to associate a feeling with an event.
Yeah.
And correlation is not causation. We know that.
Mm-hmm.
Mine was always, let's say I would have like a sandwich or something that was sort of like a pretty standard lunch, right? To have a sandwich, and then you'd have the coffee after for your lunch, and you get that crash, the postprandial crash. And you're going, oh, I've had too much coffee today, when really it's not what's actually happening, right? So you associate the wrong event with the actual feeling, and what's actually happening now that I'm able to track and know what's happening is like you have that tool, which is interesting. Let's get into quickly the 4 horsemen, just because you brought it up, to make sure that everyone has a lens on that.
Yeah, well, cancer, right, and cardiovascular disease, dementia, Alzheimer's, I put that in the same bucket, and then metabolic diseases, right? So one could even say that these are all pathophysiologically linked to glucose dysregulation to some extent, right? We study obesity or metabolic related cancers, right? And there's about, a couple years ago there was 6, but I think there's like at least 10 cancers, obesity, GI cancers and endometrial cancer, things like that. When it comes to Alzheimer's disease, that is, even by definition now, a hallmark characteristic of dementia is glucose hypometabolism in the brain. So the brain is not, for a number of different reasons. And cardiovascular disease is associated with, the health really of the endothelium. That's really important in the context of glucose regulation, and inflammation as a main driver, and glycemia is sort of really important for that. And of course, metabolic disease like type 2 diabetes, obesity. So all of these things, all these chronic diseases, or the 4 that I just mentioned, are the ones that are likely going to kill you. And I think that the sooner we get in charge and control of our metabolic health, we have, and I think the literature would support this, we could delay the early onset of the 4 horsemen by at least a decade if we can intervene, for example, in our 20s and 30s before it becomes a problem. I mean, this is, it's not my opinion. This is the general consensus of experts now that kind of research this epidemiologically, and even from the context of, big systematic reviews or umbrella meta-analysis that just look at the data and longevity. And I think we're now at a very exciting point in time where we have the tools, to manage that. So.
Yeah, when we think about these tools, just like a contractor, different tools do different things.
Yeah.
A wrench is not going to do the same as a chainsaw, right? Like they're just 2 different tools. And I think we've got, as people build their own foundation and their own understanding, and it's an ongoing journey for all of us, where we're constantly updating our priors to say, what have I learned today that I didn't know yesterday, and how does that change what I already know? A lot of the insight that we can gain can be from using the right tool to understand the right thing, to proactively understand our health. But I think there's this challenge of building resilience by having the data and knowing that a tool is a tool versus chasing perfection. So what's your outlook on how people can best use these tools without getting into this idea of, getting sort of maybe getting down on themselves, or even leading to, it can lead to conditions of orthorexia where people are almost afraid to put certain food in their mouth because they're saying like, how is this going to impact my glucose, or how is this going to impact my whatever biomarker they're measuring, right? How do you think about the way people can best utilize the tools that are at their fingertips without getting into a point of obsession over the data that they see?
I'm glad you bring that up because it's an important question and an important conversation to have. And I think orthorexia, for people that don't know, is just an overly fixated position when it comes to the type of food that you're eating, the amount of food that you're eating. Kind of very common with overly health conscious people, maybe people in the fitness community. But also I see it with patients who kind of do a lot of reading and Googling when it comes to sort of like trying to get perfect glucose levels for the metabolic management of a disorder, for example, that is, responsive to carbohydrate restriction or ketogenic diets or things like that, things that we study. I think that it's important to look at trends. I think the most important thing is to look at trends and even to pay attention to various alerts that the app may give you if you're trying to, say, for example, if you're monitoring glucose and you want to stay within time in range, for example, in diabetes, right? If someone has type 1 diabetes or type 2 diabetes, you could set the parameters for your glucose to be a certain time in range. And at the end of the week, if you could say, oh, I've been in, I had 80% time in range as opposed to last week, it was 70%. So that's a win for me. So I'm in, the trend is going in the right direction. So you can make actionable adjustments on your behavior based upon, trends. But when the anxiety or the too much thought, time, and effort is being spent for perfection because you think perfection is optimization, that's when it becomes the tool is more of a liability on your mental health and your well-being, because you're overly fixated where you could be spending time, effort, and resources, on other activities that you should. In the context of patients, it can be important, but I think an overfixation on it needs to be, in the context of patients, that needs to be vetted out with their healthcare provider. But I also think that having a toolkit that kind of allows you to predict that and actually tell the person to make actionable suggestions instead of a prescriptive changes is important. And I think they need to focus. I think people really just need to focus on trends and improving their trends as opposed to individual like numbers or just, and I think it's a little bit of a slippery slope for people. Mm-hmm. But I think that the data does not even support, for example, that glucose levels within a super tight range are going to be beneficial above glucose levels in a somewhat wider range. So until that data is there, it's not even worth people to be overly fixated on that. And I think data is currently looking at that, glycemic variability in non-diabetics, and that's an area that we're really delving deep into now. And to tell you the truth, it's really hard to find a lot of good evidence that glycemic variability where your glucose is shooting above 160, 170, that whereas if glucose, stays within 140, 150 to 70, there's good evidence for that. But it has to get kind of high and there has to be considerable variability to pathophysiologically link that to, endothelial dysfunction or cardiovascular events or renal dysfunction. So the data is not there yet to have.
Yeah, and I think it's hard too because from an education or an understanding standpoint, it feels like there's a responsibility on behalf of the company to help to manage the outlook, right? Like we don't want people, and we hear it, people ask all the time, oh my gosh, I had a massive glucose spike from a workout, and like, is that bad? You know, people don't understand what's actually happening physiologically, where it's like, no, that's just stored glycogen. It's fueling your body because you needed it, because
if you didn't have that probably indicative of sympathetic nervous system, and also productive workouts are correlated with an elevation of cortisol. And if you're not getting that, cortisol is actually one of the best predictors of actually, adaptive, progressive training adaptations over time. So these are to be expected with a certain intensity threshold. And if you train super intense and you don't see that, I would say that's more of a problem than not a problem. But how your body responds and the time it takes for the glucose to come back down could also be, you want, when you exercise, you want your sympathetic nervous system to be activated, but a good marker of physical health is the parasympathetic tone, bringing that back down, right? And your heart rate back down. And a healthy response to oral glucose tolerance test is for it to shoot up like 50, 60, 70 points. But that area under the curve and the dynamics of the glucose going up, it give you insight into beta cell function and also insulin resistance. You'd never know that without CGM, right? So, the important thing is not to panic with spikes, but to actually look at the data to give insight into what's happening with your body.
Exactly, and I think it's important to note too that, like, we can reinforce it over and over. Glucose is a single molecule; it's a single biomarker out of this ongoing, oscillating symphony that is happening in your body of all these biomarkers moving. Some are moving in unison, some are moving with an inverse correlation in what they do. But I know Peter Attia talks about it often, where if we only look at glucose in isolation, and this is back to the idea of obsession, where the spike, right, the amplitude or the duration, like, those will tell us different things about someone's metabolic health. But again, a single marker. The more important thing, and there's still literature coming out about it, is where is somebody's insulin going when that spike happens? Is it overshooting by however many points, right? Let's say, does somebody's insulin go to 25? If maybe their baseline's like 2, does it go to 25 with a glucose spike? Does it go higher? Like, where is that going? Because getting that picture, and that's back to the importance of having tools that do different things to give us an overall picture of our metabolic health, that will indicate how insulin resistant somebody is, more than just looking at the single glucose spike. And so we have to understand, back to the obsession thing, is to become obsessed over one measure of tracking our health is not where we want to get to. And now, with that said, it's the balance, right? If somebody, let's say, because levels, we do blood tests too, if somebody sees that their ApoB is quite high, let's say it's over 150, like an amount that is objectively out of range, it's not that you want somebody to become obsessed with it, but you do want somebody to take it seriously, that, hey, there are things that you can do. There are interventions you can take and steps towards lifestyle changes to take your health into your own hands so that you can get down to a healthier range. And for some people, that might involve diet, sleep, and exercise changes. Or maybe somebody has genetics that are leading them to have markers that are in a certain range. And for some people, pharmacological intervention might actually be the right approach. But again, that's not for levels to prescribe. That is a conversation with a medical professional. But again, it's this idea of tracking, using tools, getting the data, seeing that data, and then building resilience because you have the data, versus becoming obsessed with the way that you think about that data.
Yeah. I mean, all great points. And I think the earlier you do this, I actually started getting blood work, I think, in the early 90s and stuff, just because I was on a drug, Accutane, I think, for acne, and it was just like a requirement, and I became fascinated, like, with my own blood work. So always took advantage of that yearly, insurance would allow for that. But the sooner you get ahead of the problem, like, I can go back and see what my liver enzymes and where my kidney function was in my late teens, in my 20s and stuff. And I think that's really important for people to have, where they can longitudinally track, or even like a DEXA scan if you want to measure that. But glucose, if there's one metabolic marker that's a better window into your metabolic health than anything. It would be continuous glucose monitoring, and maybe heart rate too would be kind of in there too. And we have tools for that. But glucose becomes, as you alluded to, exponentially more informative in the context of other biomarkers. And it's not just cardiometabolic, it's neuro, cardio, immuno, metabolic, we could just call it cardiometabolic, but these biomarkers have, direct impacts on pretty much, all these, different functions. And in the context of continuous glucose monitoring, it becomes much more informative and gives more context to those trends.
One of the big challenges, I think, was we're at somewhat of a breakthrough moment in sort of the history of health and how it's progressed and developed. But the ability to track glucose is now more democratized, with Dexcom's come out with a new device called Stelo. Stelo is an over-the-counter biosensor where people can track their glucose. And previously, people required prescriptions. These devices were somewhat stigmatized, and Stelo is around $100, and glucose monitors over the past couple of years have been around $200 per month for this device that is a disposable device. And so how do you think about this idea of being at a point in time where technology is becoming more accessible, because people are not prevented before? If they couldn't get a prescription, they couldn't get a glucose monitor. Now people can get them over the counter. The cost has come down, and I think over the course of a number of years, as technology progresses, it will continue to come down. But how do you think about the benefits of having more democratized technology so that it's more accessible and available to many people?
Yeah, huge benefits, especially when starting early. And I think the technology, the economy of scale, the competition in the marketplace are going to bring, the price point down to where this becomes, a cup of coffee a week, like that kind of, expense. And in the context with continuous glucose monitoring, even wearing for, 4 weeks, a month, which is a minimal investment if, for a year, for example, just doing it periodically gives you tremendous insight into that. And, that going into the app and then seeing other variables correlate with that is going to be, so insightful and motivating. It's going to be a really tangible tool for actionable change for people to have that awareness. And some people probably maybe they don't want it. I've talked to people who don't want to wear a CGM because they're worried that it's going to be like the food police, right? I mean, these are people who maybe just are not, maybe a different mindset, but I think there is a part of the population who maybe are not ready for them to have that level of truth to their metabolic awareness and making the food choices that they need to make. It's almost like having a dietitian look over their shoulder. But for people that are, especially young people, and I think the majority of people they want to make a change, but they're just not absolutely certain how to do it or the right tools and methods to do that. So I think we have those methods, and I think it's going to be democratized in a way to make it affordable. Ideally, it would be, and I always say this to our medical students, like if medicine wants to focus on human health, they need to invest into prevention. So I think the healthcare industry needs to kind of support prevention instead of, disease management, or sick management. They need to really put time, effort, resources, and finances into preventative strategies. And, I can't think of anything better than, a CGM, just getting on. For example, if you have, families where everybody over the age of 50 has overt type 2 diabetes, like those family members and offspring need to be checking glucose and monitoring it in their, 20s and 30s and 40s. Mm-hmm. And that's going to have a huge impact on the healthcare costs of managing that potential disorder, which is likely to trajectory suggests historically that it would be going in that direction, and all the comorbidities that come with it, for type 2 diabetes. So, and I think, there's movements in place right now, I guess we could say, without going too much into it, where I think the pieces maybe are coming together with more preventative strategies for metabolic health.
Yeah, well, I think one of the interesting things is that there can be an aversion sometimes too when we face it. We're educating people about a new product or a new category, and when people don't understand the utility of something, or maybe they have a mental model of what that thing is and what it does, and there's somewhat of an aversion to trying that thing. So we talk about Stelo right here. So form factor is about the size of a quarter, right? And it's got just the tiny little filament in it right there. You can see it. It's about the size of a hair, and it's it's very minimal. It is invasive technology. It goes in and it reads your interstitial fluid. That's how it's getting the glucose reading, and it's a enzymatic electrochemical sensor. So from a technical standpoint, it just means that there's a little enzyme on the end, glucose oxidase, and that has an electrochemical signal that is sent by interacting with the interstitial fluid. And that's what sort of gives you the glucose reading or the data. But I think that the hard thing is that people, and for anyone who is watching can see it, anyone who's listening, hopefully it was described fairly well. But
it's a quarter.
Yeah, it's about the size of a quarter. And
slightly thicker maybe.
Yeah, you can check it out if you want. But that's the Stelo device. And so when we go through these cycles of, we call it the metabolic, the metabolic education curve and timeline. The curve is steep. So if you go without any understanding, you're coming in fresh, without any understanding of what is metabolic health. The curve to get from 0 to some level of understanding, it's not nominal. It is steep. It takes time. And it's long, right? It's just that it's back to compounding. It takes a long time to build that foundation and constantly update your priors. It's very different than educating people. If you, let's say you and I had a white t-shirt company and all we sell is white t-shirts. There's not a lot we need to do to educate people about the utility of a t-shirt. We're strictly selling on the value prop of maybe what makes that t-shirt different from a fit or a fabric or whatever standpoint it is. But we're basically talking about brand. It's natural that people have an aversion to glucose monitors or biosensors or even any wearables when they might form a mental model of, oh, there's a needle that sticks in my arm, and it's actually not a needle. It's a tiny little filament on a device that's about the size of a quarter, and for many people it just goes on the backside of their arm. And they'll wear it for a duration of 14 days with Stelo. And so when people don't know that there is a needle that actually is used in the applicator to get it in, but it's just spring-loaded, goes in quickly, and you don't feel it. It feels almost like a pinch. I think it's natural to sort of have this aversion that, like, I don't want a needle sticking in my arm. And, and so once people understand what the device is, and then there's the utility part of it, what it does and what it can do for me, you get into this idea where as soon as people start to see the data and they try a wearable for the first time or a Stelo biosensor, they can see that magic moment of what's actually happening to their glucose. I think that's where the unlock is, but it's natural that it takes time for people to understand what it is, why they should use it, and how it can benefit them, because it's full circle back to the if you have a condition but you don't realize you have the condition, then you don't know you should be using the thing, right, that can help give you insight about your own health. So yeah, it's interesting, but I think a lot has changed in the market. We're in this breakthrough moment, and with these biosensors being democratized, where they're more accessible to more people, it's going to make a big impact on health.
Absolutely, and I think the safety, the efficacy has been proven, and then the barrier to entry for people to just know what their glucose is and to monitor it is really low with this, I think. And in our patients that are wearing the device, and the study that we did in people that were non-diabetic, they one of the biggest, when we sent the questionnaires out, they were much more comfortable using a continuous glucose monitor and felt that it was a lot more user-friendly and painless than having to prick their finger a couple times a week. So with a lancet, which, millions of people with diabetes in the U.S. do all the time. They just do it routinely, and I do it too, just to check and for other things like other metabolites. But I think if people are worried about pain, you could probably convince someone that there's no needle. It just has like a little sticky, it's just a Band-Aid sticking out. And oftentimes, especially on the back of the arm, I never even feel it. I don't feel anything going in. You hear the click, and then it's stuck onto your arm, and then then you're getting glucose. You're good to go. So it's that easy. And I think people may not know that if they don't try it first. Occasionally, you will feel like a little prick if it goes into your arm, and you just feel like a little, but it's essentially it's instantaneous, and it's so temporary. Like the little, it's far less than even maybe like 5% of a bee sting or something like that. But generally, I don't even feel it going in when I click it in. So I think people they wouldn't know that if they pull it out and then look at the needle, which is about, a quarter to a half an inch, or maybe, less than a half an inch, but they don't know that it's relatively painless, or in most cases, not even painful at all to stick it on. So I had to convince various people in our research that yes, so they pretty much unanimously, ubiquitously across pretty much everybody was like, oh my God, this is so easy. I didn't realize that, how easy it was to stick this on. And so nobody wanted to prick their finger after that. And that's a relatively easy thing to do, and, with minimal pain. But this was far, far easier. So I think in the context of ease of use and patient acceptance, this is a step function above having to prick your finger to get glucose.
If you think about the future of health reimagined, so as these devices, these wearables are becoming more democratized, imagine you and I have Dom and Ben's advisory policy advisory Inc. We've got this little company. We're able to advise on how we can impact health, and we come up with an initiative to give every 25-year-old, or maybe people reach the age of 18, right? They reach some age where we have the ability to give them wearables or things like biosensors to get insight about their own health. How do you think that would change sort of the future of health reimagined? Like, what are the downstream implications of making this technology accessible to younger populations so they can start to get insight early? How do you think that would sort of change health 10, 20, 30 years from now in what we're seeing today, where we know we're spending trillions of dollars in the U.S. on healthcare to manage conditions that people can proactively mitigate if they get in front of them? How do you think about just some of the downstream implications if we were to do that, if we were to give every 25-year-old a biosensor to monitor their glucose?
Well, I think it's a game changer if, a lot of 25-year-olds like to gamify things. So being able to meet them where they're at and, give them a technology that gives them the metabolic awareness for them to understand their glucose, average glucose levels, which is reported, throughout at the end of the day and at the end of the week, and to understand their own trends. And then they can make actionable insights. They can reflect back on how they're eating, what they're eating, where they ate, restaurants or whatever, and then make subtle changes that will have compounding interest over time and pay big dividends in the context of averting the early onset of many age-related diseases. So I think, for the average 20-year-old, it really gives them the tool to be proactive instead of reactive down the line. So even me, like when I turned 40, and like there was things that happened as a consequence of, my early years of eating high carb diets over time that I feel that I probably could have reversed or attenuated significantly, I think, if I had this technology. And I'm a pretty healthy, active person, relatively speaking, whereas the large, a good percentage of our population is not. So I think that the earlier the intervention and metabolic awareness and more proactive they could be, that is going to have a massive impact potentially, if there's early buy-in to this and acceptance. And I honestly can't see why, especially with the technology emerging in a way to make the price point affordable, even in the context of just using intermittently.
Mm-hmm. Yeah,
Right.
I mean, people get into their 40s, their 50s, their 60s, and they're seeing changes in their bodies, depending on gender. Some might be hormonal. Depending on lifestyle changes, there are all of these things we know. Once people reach, let's say, around 40 years old, they start to face more sarcopenia, where they're losing muscle mass without intentionally trying to build it. So there are ways that you can get in front of that, but people might get a checkup and then they think, oh my gosh, things have gone sideways, but it's back to that. This has been something that is compounding over time. And so the earlier we can give people tools that they can manage their health, and there are many tools, as we've brought up a few different times, that there are many tools that can help people to get different insight about different markers of their health, so that they can really take health into their own hands.
Yeah, and as we were talking about, the glucose monitor is, even in and of itself, it's a powerful tool, but in the context of doing your blood work and also just adding, a half dozen to a dozen or more, various biomarkers, your insulin levels and HSCRP for inflammation, for example, hemoglobin A1C too, just seeing how that correlates. But your average glucose is a direct measurement, whereas, hemoglobin A1C, which is on blood panels, is just an aggregate of your glucose, is not capturing, the glucose spikes. And of course, DEXA scans, body, or even your body weight over time. Like the glucose trends and data will give context to that information and vice versa. And I think that's really the benefits here, is that the synergy of the information, and also with new bioinformatics tools, being able to do correlation, which we're doing, in the context of academic research now, just looking at correlation trends of glycemic variability with insulin, correlation trends of glycemic variability and high sensitivity C-reactive protein, things like this. And we're just delving deep into the data. And I think, a software platform that can sort of do that analysis and give context to that is going to be tremendous.
How do you think about the conflicting health advice that's out there? We often hear one person will say, do this, and then someone else who's maybe a thought leader that is equally respected will say, don't do that. The thing that you just heard somebody say to go do, somebody else is saying, don't do that. So how do you think about this conflicting health advice, or what is something that when it comes to metabolic health is maybe misunderstood or overhyped or misconstrued? Are there any things that sort of come to your mind that people are holding on to that maybe they could let go of based on data that you've seen through your research, or maybe literature that's been published over the past few years that should update all of our priors, but people are holding on to old adages that are no longer true?
Yeah, a lot of things come to mind. I mean, we're in the research. We do research on low carb diets and specifically ketogenic diets. And I think over the last decade, I think we're of the opinion now, for the most part, that fat is not inherently bad, and that high fat diets in the context of low carb are absolutely not inherently fattening. I mean, that was the view, of course, in the 80s when I was growing up. Everything was super, super low fat, and have to admit, even in, when I got into nutrition, studying nutrition in college, I wouldn't even eat an egg yolk. I would just give all the yolks, either throw them out or give some to my dogs. I was just only egg whites, like only skinless chicken, only, super lean beef or whatever. I stayed far away from fat as possible. And can't say that, that had, well, I can't say for sure that it had consequences, but I did suffer, from various things like eczema and everything. That went away when I started doing more low carb diets and things. So I think for one of the misconceptions is, and I think we're of the opinion now that fat is not inherently fattening. And that fat is really good to have. The type of fat is important, and there's conversations about, percentage of saturated fat being below, 20% of your total fat or, total calories or whatever. And I think, there may or may not be some truth to that. I'm still skeptical, of saturated fat. And I think evidence is pointing in the direction that it's not problematic, but I do think that monounsaturated fats and omega-6 fatty acids, these things are not only important to have in the diet, but like omega-3s and your omega profile, your fatty acid profile is a very good biomarker. And I think, you're doing like the omega quant tests or various tests that look at the ratios of the different fatty acids, the omega-3s, docosahexaenoic acid, DHA, and EPA. I think the data is actually going in the directions now that this should almost be part of standard blood work, because blood levels of these fatty acids correlate very highly with our general health status. And I think that is an area. So that would involve eating, a diet that's rich in fat, or higher in certain fatty foods. And the other would be sort of like all calories, the energy balance equation, that a calorie is a calorie. And I think that there's a lot. We know that calories do matter in the context. Energy balance matters, but the type of calories that you are consuming are an equally or more important factor, right? So, for example, obviously, Pop-Tarts versus broccoli, and I think people just understand, these are inherently different. Even if they're equated for calories and carbohydrates, they're inherently different foods. And what continuous glucose monitoring the insight that it gives you is that you could eat a predetermined amount of carbohydrates, and it gives you the insight that calories, a certain amount of calories and carbohydrates, that calories are not, the type of calories are just as important as, the total calorie count. In regards to that is sort of information for your body and produces a physiological effect, which could be diabolically or different, diametrically like opposed. One could have a 0 glycemic response where others can spike you up into the 200 range. So I think CGM gives you an appreciation for that all calories are not created equal, especially in the context of carbohydrates. Fiber is a super important key. So when we design diets, it's like protein, fat, and fiber in regards to the carbohydrates. So the carbohydrate source should be selected based upon the fiber content. And if you're designing a diet, and if you choose a carbohydrate source, if one rule of thumb is if the carbohydrate source has more than 25% of those carbohydrates are fiber, that it's hard to go wrong in picking your, the types of carbohydrates. And I get that question a lot, so I am a believer kind of in fiber, and that's beneficial. Of course, fiber is not an essential nutrient. There is no requirement for fiber, but the epidemiological data and points, which is there's confounding factors there, but all the data is pointing to that fiber is beneficial for the gut microbiome, for preventing various types of GI cancers and things like that. So that's not a calorie issue. It is the type of food. So I think, that's a long-winded way of saying, okay, so the energy balance has, some issues. Calories are not created equal, and high-fat diets or fat is not inherently fattening. I think these are two things that kind of come up quite often and will probably be debated 10 years from now. But
yeah, I mean, it's such a good point though, is that, and I think it's challenging too, because with tools like social media, where people have the opportunity to see all these differing points of views, and you look at people, let's use the fitness community as an example, there will be people that have certain philosophies for the way they fuel their body with the caloric intake they have. How do you bulk, right? And then you'll see other influencers who say, no, it's okay, go and eat the Wendy's cheeseburger and bulk with this many calories because that's how you're going to get big and strong, and then do the cut after. And it's like, that's just not true. Is don't go and eat the highly processed food, or you'll see, again, back to, it's not everyone, but some people in the fitness community will say, I'm on a bulk right now, and they'll be drinking 2 or 4 liters of chocolate milk in a day. And it's like, well, what's in that? That's, if you want to drink milk as part of your bulk, don't drink the chocolate milk because it's got unnecessary added sugar in extreme quantities. And that's back to like overhyped and misunderstood advice, is we don't need excess sugar that is not naturally occurring in fruit in our diet. We just don't need that. And so, like, that is, if people are listening to some of this advice that's out there, that is not true. If you do want to have, like, let's say somebody's on a 4,000 calorie diet per day, but they're getting that through cruciferous vegetables and protein and back to fat, right? You're getting maybe lots of olive oil, or maybe you're eating beef that has more fat content in it, and you're getting your caloric intake in that way. Great. Whole foods, you're in a good spot. But the idea of, I'm on a bulk so I can eat ice cream and Twinkies and all of these things day after day after day, back to balance with, like, not becoming overly obsessed where you say, hey, I can't do this thing once in a while because I'm making sure that I'm balanced in my mental health and the way that I'm approaching my philosophy. Everyone's going to have their own personal philosophy, but their own philosophy about what fuels them. That's where we want people to be. But we don't want them being in this place where they go, cool, maybe they're on a cut back to fitness, and they say, I'm trying to maintain a caloric deficit, 500 calories less a day. So I'm going to eat 1,700 calories a day. But of those calories, lunch was Jimmy John's and a bag of chips. And maybe, it's like, don't do that every single day. That's not, the calorie is not the calorie. And I think that's a good point you bring up, that the source of the energy and the micronutrients that you get, the macros and the micronutrient breakdown of those, the fuel that you put into your body, that becomes your biochemistry. That is your biochemistry. And so it's very important that people are understanding this.
Yeah, all great points. And one thing that came to mind just as you're talking, and I think it may be an important point to bring up, that CGMs have been sort of marketed or promoted in the low carb community, because if you're on a low carb diet or ketogenic diet, it's very flat. Your glycemic control is exceptional, right? But I'm in touch with people. I actually think maybe one of the better applications of continuous glucose monitoring is for people that favor a high carb diet. So I'm in touch with people that are part of various groups, for example, in the fitness community, where they are trying to maximize the total amount of carbohydrates they can eat while they're bulking, for example. So, and they're on a balanced, they're macros, they're counting macros, and they titrate in the amount of carbohydrates to prevent them from what they call like spilling over. If it's like, in bodybuilding, you can eat a certain amount of carbohydrates, and what they find anecdotally, and I think the literature supports this, that once you top off your glycogen stores, if your body's still hungry for carbohydrates, if they're training really hard, they clear those carbs really fast. And they are eating a lot of sugar, sweet potatoes, rice, oatmeal, fruit, and things like that. So I'm in touch with a lot of guys that are doing this, and then they report back to me that, the CGM is perfect because it allows me to understand how much carbohydrates I could put in 100, 150, 200 grams, like in a meal. And then if I see it continuing to be elevated, I know my glycogen is kind of topped off, or I need to, change my training around and things like that. So kind of on the other end of the spectrum, I think people that are carbohydrate fueled, even during exercise, if your glucose level is trending towards being hypoglycemic intra-workout or intra-marathon, or, an event, then you can precisely and personalize the adjustment of your carbohydrate to optimize performance, to keep you within a certain window that would then provide an efficient fueling strategy for that. And I think it almost becomes like more important, it's great for low carb diet because if you have type 2 diabetes and you go on a low carb, I mean, it's very rewarding to see your glycemic variability come down, and within a window of glycemic variability that would correlate to ideal, glycemic control or metabolic. On the context, I'm in touch with quite a few athletes that are embracing high carb diets, and they use the CGM to help them titrate the amount of carbohydrates they're doing to bulk up or to, do post-workout glycogen carb loading. So if it stays sustained and elevated, they know they've eaten too much carbs and they're kind of spilling over, and then they hold water, they sodium retention. So it becomes a lot of guys in this realm have an intuitive sense of that, but the CGM guides them on how much carbohydrates they can consume. So that's another area maybe not talked about enough, where there's like sort of an echo chamber within the low carb keto community, is that this is the tool to validate that eating pattern. Whereas if you jump on the other side to people who embrace high carb diets for performance optimization, are saying this is an ideal tool that allows me to maximize the amount of the carbohydrates that I should be having. So also understanding that, switching this type of, this potato instead of rice or whatever, I get better glycogen replenishment, and I can get, 130 grams of carbs instead of, 80 or 90 grams of carbs from rice. I mean, guys are actually becoming that granular with their, with understanding their bodies, using CGM in that context.
Yeah. The idea of being able to better manage your fuel so that you can see that you've got that window into your body is a big unlock. And I think even many women who track their glucose for the first time and start to see how their body changes over the course of a month, depending on where they are in their cycle, how insulin resistant they are, they can manage carbohydrates, they can exercise in different ways that the CGM is giving them that feedback to say, oh, I understand. And they're starting to be able to correlate the events and say, oh, if I am going to eat higher number of carbohydrates, here is where I am in my cycle, and maybe my body is going to my body will metabolize those carbohydrates differently because the body is becoming insulin resistant naturally as there are hormonal changes. And I think when women and more women now, especially with Stelo, they'll be able to see what's happening to their glucose in real time. They'll see that their body naturally through pregnancy, if they're pregnant, they'll see that they're entering into a more insulin resistant state because the body has to do that to grow a child so that that child can get that fuel. And so
spares glucose for the,
exactly,
for the growing fetus. Yeah.
Exactly. And so whether women are in family planning years or if they're maybe in, let's say they're going through menopause, they'll see the changes that are happening in their body and how their energy oscillates depending on where they are, the life stage that they are at. And so just having access to that tool. So whether, as you brought up, maybe there are people in the fitness community who want to optimize their energy and really understand the detailed level of how do I make sure that I'm always in the right state, depending on what their goals are, or people that are just living a regular lifestyle that might not be trying to optimize, but saying, how should I be fueling my body? Because energy is energy in the sense of nobody wakes up in the morning and says, hey, what's going to feel great? Like, I want to feel low energy today. No one does that. No one wakes up and goes, today I want to be angry. Today I want to be upset. Like people wake up and they go, it'd be nice to be happy. It'd be nice to have good energy. It'd be nice to feel great. And so the more that we can give people these tools so that they can understand how they can achieve those goals and those feelings is a key unlock.
And to understand why they're not feeling great, why they're not feeling, or they're feeling hypoglycemic. It just reminds me, I had several emails from women that were going through menopause. So I took a deep dive into the literature, and menopause is associated with glucose hypometabolism in the brain. So dietary changes are going to be really important to do that. And that's, the conversation was leading towards like ketones because they can offer an alternative fuel for energy. But I think, it's important, that's really important too, but just improving glycemic control and exercise and other things that improve insulin sensitivity are going to be more beneficial for women that are going through menopause. So meaning that they need to have higher sort of vigilance and oversight over their glucose variability, because there is profound changes in glucose metabolism with menopause in particular. And I was unfamiliar with the literature until I started reading some of the reports showing a pretty clear as estrogen levels drop, that can actually profoundly affect glucose metabolism in the brain. So, and maybe, the importance of, hormone replacement therapy for some women who want to go in that direction. But nonetheless, it's important to understand, glycemic patterns. And in particular, the conversation was such that women were reporting back to me that if I keep my glucose within this range, I could avert all these problems associated, energy, problems and mood problems, mostly from a mental health mood disorder. I could avert these by keeping my glucose within that tight range. So it got me thinking more, for female health and actually doing more research in that area, because I think these tools have maybe a unique application for those, changes that women go through hormonally.
When you think about, as you've gone through these cycles, you've been monitoring your health for decades now, and you've been started out doing it in the journal, and still do it manually in the journal with fitness. But now as things have become digitized with technology, what are some of the changes that you've seen in your own data? So as you've tracked glucose and start to use things like the Levels app, where for anybody who's listening, we're just pulling it up, you can see your habit loops, and you can see your glucose, the trends that you see over time.
Good glycemic control there. Yeah.
There you go. And you can see even things like macro breakdown of caloric intake.
I have days that look that good and days that don't look that good at all. So,
which means you're a human.
Yeah, absolutely.
But when you started tracking your glucose, and we talked a little bit about things that grow on your farm, things like mangoes, things that maybe fruit that would have higher sugar content versus fiber. So mango versus, let's say, raspberries, very different in the amount of naturally occurring sugar that you're going to be getting from that fruit and fiber. What are some of the trends that you started to see as you tracked your glucose, and then some of the lifestyle changes, whether diet, whether sleep, or whether exercise related, that you weren't aware of previously because you didn't have that real-time monitoring?
Yeah, I think the biggest shock to me was how foods that are even like relatively high in fiber and like foods that are considered super healthy caused pretty big spikes when eaten by themselves, at least, and even a postprandial dip in glucose that led to sort of, a hypoglycemic feelings. So oatmeal comes to mind. I grew up, eating lots of oatmeal, throwing protein powder and bananas and everything in it. So that elevated me as much as a can of, sugar-laden Coke. And so that was really interesting. And you mentioned the mango thing and the types of fruit too. So I eat wild blueberries. So I buy wild blueberries, and I've compared it to just like the standard blueberries you get, at Walmart or whatever. And there's a good 30 to 40% higher spike with regular blueberries versus wild blueberries. And you can kind of predict that because wild blueberries are much, much smaller. So you have more fiber, and the sugar content is maybe about 20 to 30% less, at least from the ones that I buy. So that was sort of important insights, and the CGM was capturing that information. In regards to the mango, that was really insightful in that a very ripe, soft mango caused a massive spike that was similar to drinking like a can of Coke, right? However, I like my mangoes to be like semi-ripe or not quite ripe and almost crunchy and crispy in a way, or kind of tart. And a mango that's not fully ripened to be soft, that's more tart and crispy, almost like an apple, caused very little change in my glucose. And that was pretty remarkable. And I kind of enjoy it that way. It takes a little bit more time to eat it and chew it. And and I like the tartness of it. So just my flavor kind of preference. So I tend to, if I have mangoes, I tend to try to eat them before they advance to the super soft, sugary form. So there's a lot of insights like this that I would have never, had. I mean, obviously it's much more sweet. So you can imagine, more starch has turned into sugar in that way. But it's given me some actionable insights into the types of carbohydrates that I eat. I'm pretty low carb all the time, but I do. There are certain things that are considered, carbs that would spike. And I know Josh Clemente told me that lentils really spiked him, and we have lentils like occasionally, and lentils pretty much have no spike on me. And I was thinking, okay, maybe because I ate the lentils with some protein, but then I had lentils by themselves, or at least maybe it's the way my wife cooks them, that it was very minimal, maybe like a 20 milligrams per deciliter like increase, whereas other people I see post and see they have pretty big spikes. So it's really been a guiding tool to help me choose things that are actually a guiding tool towards having more protein, having a diet that's more protein centric, that has a good complement of healthy fats, or moderate to even high fat in the context of low carb. But it guides me towards carbohydrates that are higher in fiber. And I think that is a really important insight that will have really beneficial, actionable consequences to people who use CGMs. So it'll guide them towards more high fiber foods and foods that are kind of lower on the spectrum of sugar.
Yeah, and the state of food too is really interesting. Where if you cook sweet potato, or let's say lentils, you're cooking some food that has starch to it, and you eat it immediately, and you might see, let's say you eat it, let's just assume you're going to eat it with one serving of chicken breast and maybe one serving of broccoli. So it's sort of a balanced plate. Yeah. And then the next day you eat that exact same meal, but you eat the leftovers, and those have been sitting in the fridge. Well, those sweet potatoes have now built up resistant starch, where your body's going to metabolize that very differently than it did the day before. And you're going, what's going on here? But there's just so much from a biochemistry standpoint. There's so much that's happening in the way that it's not just the food you ingest, it's the way that your body is breaking it down, given the state that food is in. Same thing with the mango as you're talking. It's a different state or different period of time in which you're eating that fruit versus a very ripe fruit. So it's just having, I think being able to be conscious and aware makes a big difference.
And your personalized response to it, right?
Exactly.
Like your microbiome will dictate how the food sits in your gut, and or whether it reacts to your gut in a negative way, and then the glycemic response and the immunological response too, especially if you're suffering from leaky gut or impaired intestinal permeability, and certain foods can really be a trigger for that. And and I think CGM nicely captures that. We'll also capture if you've had poor sleep, or you're lacking sleep, stress, work stress. I see the same meal can have a different effect on my glycemic control based upon maybe cortisol or sympathetic nervous system. Also an illness too, not just a GI illness, but just having, I think I got a mild form of, COVID like years ago when it first came out, and I saw, oh, okay, this is some interesting, data. So we started researching that, or just, asking around and looking at different patterns. But you quickly become insulin resistant in the context of, illness or an infection. And that's kind of interesting.
Yeah.
So,
and how sometimes you brought up cortisol. That's interesting too, because you have something like, if people have caffeine first thing in the morning, if you have that caffeine before you eat, but you ingest that caffeine very quickly, maybe you're very thirsty and the coffee's not that hot, and you slam it back, you chug that coffee, and then you go and you eat the exact same thing that you eat every day. And you go, why is my glucose, my baseline, so much higher than, maybe it's 10 or 15 points higher than what you normally see? It's all these things that are happening physiologically, or that same, let's say there's not coffee involved, that raise your cortisol, and you just have that same, say it's a yogurt bowl with some fruit and some nuts in it and some flax, where it's pretty balanced. And then you go, why is my baseline that so much higher? It's instead of eating it in 15 minutes, you've eaten it in 3 because you're trying to shove it down. It's your body is getting that fuel, getting that caloric intake so quickly that your glucose and what's happening physiologically, that we don't know how every molecule is moving in our body in real time right now, because that is a big gap that exists in the world. But we don't know what's happening. But what people see from a data response is, why is my glucose higher? It's back to, well, how much did they sleep the night before? Did they exercise the day before? How fast did they ingest that food? So you're constantly tweaking all of these little levers that we have at our disposal so that you can understand. And if you do see the higher baseline, it's not necessarily a bad thing that maybe your body is metabolizing that food, and your baseline glucose is a little bit higher than it was the day before. It's, as you said, it's the trend over a duration of time that we want to look at the whole picture, not the point in time and say, this is what is happening right now, and that people should become maybe anxious over seeing some of that data.
Yeah, you brought up a really good point about the rate, for example, drinking coffee on an empty stomach as opposed to like maybe having it, after your meal. The elevation of things in your blood, like, caffeine, but also your blood glucose, we can go to that, or even ketones, and I have interesting sort of observations there, can trigger a counter-regulatory effect that could have consequences for hours, like after. So that could be, slamming like a triple espresso or something like that, as opposed to. So the rate of entry of things entering into the bloodstream has, the slope of the delta change is like really important. So the rate of entry of glucose entering into your bloodstream, if it goes up 30 points, but if it does that and it takes 3 times the amount of time, can have a massive consequence on the amount of insulin that's needed to dispose of that glucose. And it will also have a big impact on your incretins and your gastrointestinal tract and many other factors related to digestion, and then the enterogastrones, the various hormones that are associated with eating a meal. So I think an important concept that I've learned in the middle of teaching GI physiology now is that rate of entry is like really important of how fast things enter circulation. And that could be like for caffeine, for example, you can have different effects. But I think that rate of entry sort of super important for insulin management, and that's where fiber comes in. So fiber is like really, and also the sequence in which you eat your food. So if you're having sort of a balanced meal per se, is you eat your protein kind of first and maybe fiber, and then save your starch for last. And that can have the data is a little bit, there's not been a really good study to sort of look at this, but anecdotally, you can look at your CGM response. And I think if you were to measure insulin too, and I think maybe there's only 1 or maybe 2 studies that have done that you could attenuate the amount of insulin. And as a consequence, then you don't have the overshoot of insulin and then the postprandial sort of hypoglycemia, that's associated with that. So I think that's like a really important thing to consider, is that the rate of entry of the food into circulation. And that's really at the crux of the problem with ultra-processed food, like cakes and cookies and pastries and Pop-Tarts or whatever, that they're hyper palatable because they essentially almost like a liquid bolus entering. So I'm actually okay with the potential for ultra processed food, as they have the convenience factor. I mean, we're going to have to send them to space and everything too. But they one lesson I think that they could learn from CGMs is that if you could design an ultra processed food bar, for example, that would require a significant amount of chewing, and that would require you to chew, and that would require you to eat the food kind of slower, but would be palatable such that you would enjoy it through that. You'd actually extend the eating enjoyment by being able to chew it more and also having the fiber factor in there. I think we could perhaps attenuate or even abolish a lot of the metabolic consequences of many or most of the ultra-processed food in there. So ultra-processed food is a huge problem, and the hyperpalatability of it, and it has a lot to do with the hyper digestibility of it and the rapid and the rate of entry of that processed carbohydrate into circulation, which impacts satiety factors and kind of overrides satiety factors and influences our eating behavior. So I think we could avert a lot of the problems with ultra-processed food if they're designed in a way that would require us to chew them, or just simply adding fiber and things like that. So that's an important conversation I was having with a couple different companies that are looking to design, I guess, what would be considered an ultra-processed food, but would just, and I guess the appeal for that would be, that's another thing to consider. That maybe people don't want to eat. Maybe part of the enjoyment of eating ultra-processed food is the mouthfeel, the rapid digestibility, how you feel. But I think there's potential market out there of creating food products that would be in that ultra-processed food, but that would not have the same metabolic consequences.
Yeah, the ingestion rate reminds me of a lot of the research that Rick Johnson's done around fructose and elevated uric acid and some of the downstream implications of that. But what research is showing is that increases in colon cancer have been correlated with increases in the rate at which people are consuming some of these high fructose beverages, where they're just going straight, basically they're going straight through us, right? And so it's not like, let's just say somebody is ingesting 30 grams of fructose that's naturally occurring in however many blueberries that would equal to a single orange juice, right? And they're drinking the orange juice in a minute because they're really thirsty. They just got back from a run and they think that they need to, they want to increase their energy levels in some way. And it's when people are doing this time and time again, that our bodies were not designed to have that fast a delivery of fructose right? And it's highly processed. Our bodies cannot metabolize that versus something that like blueberries, where it's paired with fiber. And so, the rate of delivery is such a key component of understanding metabolic health, because it is not just go and eat really quickly. And I think especially, it's not just the convenience factor with processed food or us being on the go, but I find even for myself, I have to tell myself to slow down sometimes, because you're trying to fit things into windows. Oh, I've got 10 minutes for lunch, and so you've got this food that you're eating, and it can be whole food, right? Like whole foods, you're still eating food that is healthy for you, and it's the right fuel, but you're just ingesting it too quickly, and you go, wait, my body doesn't need all this right now. What, like, I could wait an hour and I can eat later, where I can actually sit down and chew my food properly. So you're masticating like we were designed to do. Or maybe I can just have a little bit right now and then I'll eat a little bit later. But it's just this idea of when we sort of forget and we get in these hyper busy schedules that we all feel that we've got. People feel like they're pulled in many directions at once, whether it's work or personal life or whatever it might be, that knowing that we shouldn't fall into the trap of saying, oh, I just need the fast delivery of this thing because it's a means to an end. It's like, we're meant to enjoy food. We're meant to eat food. We're meant to use food as a tool to fuel our bodies properly. And so it's a good point that you bring up around people being aware of what happens metabolically when they ingest food too quickly. It's just we see the signs of what happens, especially when you've got that data from glucose monitoring to see what's happening to your actual energy levels.
Yeah, and I think our modern food environment really adds fuel to the fire in this, because just food is well, relatively speaking, it's so cheap and so accessible. I mean, it's kind of more expensive now, but I mean, I was talking to my dad just a few days ago, and he was saying, oh, when he was a kid, most of the kids were kind of underweight just because, you know, the availability of food was not there, like, you know, in the 40s and 50s. And it was just more common to basically have, you know, you look at the class full of kids, and many of them, it was rare to have even one kid that was like overweight. You know, most kids were kind of like underweight, and it was just kind of a resource thing, you know. But I think the availability of food, in particular ultra processed food, sort of reverses that problem. And I do think that, you know, the rate in which we eat our food is a really important consideration. And I think if you just look at people that eat faster, they tend to be the people maybe that gain weight fast. I was in the position of just, I remember eating like just peanut butter and jelly sandwiches on the way to running to after class to football practice or something like that. You know, when I was, you know, senior year in high school, I was just trying to gain weight. So, but that's kind of few and far between, right? I mean, but I know some people do undereat, especially maybe if you're younger and you have a super fast metabolism. So that quick to-go food might be an important part of their dietary pattern, but it's so ubiquitous and so accessible and so cheap that it has become the default option for most people. And I think when moms and families and just people in general walk into a supermarket, the default option should be healthy food. Like that should be the default unavoidable option. Like you go into a supermarket and it's right in your face. Like the healthy food option should be the default non-negotiable like option. And then maybe a scenario for like, it's just kind of like popped into my head. Like, remember, I don't know, like Blockbuster, like when you were younger and you go to like the VHS stores, you get, you know, they have like, you know, the movies, and maybe like the family movies should be right there. And they had like the adult movies was like, you had to go through the curtain or whatever. And you're wondering like, whoa, what's in there? And as a little kid, like with our friends, we'd peek in there or whatever. Like maybe supermarkets should be set up so you walk into the supermarket, the default non-avoidable option should be the healthy food, the whole food options, and then at the back of it, maybe policies could be put in place where you almost have to go into another region. And of course, like ultra processed food doesn't need any kind of refrigeration or whatever, that it would be like another section of the back of the supermarket to get like the processed food, where there could even be warnings like this food is associated with weight gain and decreased metabolic health. I think we need to move to that. I mean, that would be kind of a simple, no-cost option from a policy perspective of just reformatting, you know, supermarkets to have that. But otherwise, usually the thing is like the default option is you're at the checkout line and you have the candy bars right here, right? And you got the sugar sweetened beverages right here at the checkout line, and you're kind of hungry. Like that is the current default option, is ultra processed food, and we need to reverse that. Like the default option should be the whole food. Yeah.
Twinkies under lock and key, like tobacco products, where you have to ask the cashier. It doesn't
even have to be extreme. It's just like you walk in and the default option should be healthy whole food, and then the processed food should be in the back, you know, of the supermarket in a separate area. It's like, you know, snack foods, and I don't know, you could add, you know, label it with some kind of name that would just, you know, alert people or educate people that these are not healthy food options. But I think generally, like that's where the box cereal should be, for example, right? Because it should be generally accepted that I thought that was the healthy food option growing up, like just like boxes of Fruit Loops, actually had them, and Cheerios and things like that. Like this is healthy whole grains. There's grains in here. Like, you know, it's got added vitamins, so it has to be good for me. But no, that should not be the default option for the average consumer. And I think we should change things. And of course, that'll ruffle a lot of feathers. But I think this is just, you know, one thing that comes to mind.
If you were to think back and give advice to your earlier self, your 20-year-old self, or 30-year-old self, anyone who's in sort of early adulthood, they're now out of high school, or even if they are in high school, as people are starting to learn more about the world and learn more about their health and wellness, what is something that if you could give any piece of advice to younger people about health and wellness and something that they should really internalize, what would it be that you think would stick with them to form form this foundation, or maybe build some of these long-term habits so that they can have we talk about lifespan and health span, have a healthy, long lifespan?
Yeah, I think, the low-hanging fruit, so to speak, is just to eliminate sugar-sweetened beverages would be, the one thing, which I had some of that growing, and then I kind of gravitated towards less sugar. But I think it should be really focused on not eliminating the ultra-processed food, and eliminating sugar-sweetened beverages. Just that alone is, and not, I think eliminating is a strong word, but minimizing. So just using them, it shouldn't be the default option. Ultra-processed food and processed food in general should not be the default nutritional option. So the default nutritional option should be healthy whole food, maybe even single ingredient whole food meals should be the default option. And I think if you could do that 80% of the time, and then processed food or ultra-processed food 20% of the time, and just think in those kind of the 80-20 ratio, that would be huge. And I think in general too, I think our reliance on ultra-processed food, just like our reliance on drugs, I think there's a lot of kids coming up through the system now. I teach many of them that are on stimulant drugs like Adderall and various pharmaceutical, and then, just sort of the mindset that these things are potential tools, but they should be minimized. And then lifestyle changes they're healthier choices. I think we just need to be aware of the consequences of that. They need to be aware of the consequences of processed food, ultra-processed food, and having that as a default option. And I think, it's a different conversation, but I also think that there's a lot of kids that are also, and adults too, that are kind of medicated. It seems like everybody's on something, right? And maybe I could, say that too. Coming up through college, I started drinking a lot of coffee, maybe too much coffee, even using little pre-workout stimulants and stuff. It gravitated from using them for working out to using them for studying, not every day, but intermittently. But I think we need to be conscious of that, and kind of, because these things, if used over protracted periods of time, processed food over protracted periods of time, really can, cause pretty bad consequences. Mm-hmm. What I see personally is that the combination of, just for me, and I was interviewed for the school about this, one thing that I see from a nutrition standpoint is heavy reliance on these energy drinks. So sugar-laden, caffeine-infused energy drinks. So some kids drinking 3 or 4 of them a day. They're amped up on caffeine, and they're amped up on Adderall and stimulant drugs. And then the consequence to all these stimulants, is general anxiety disorder. So they're amped up on caffeine. They feel like they need to do it to study, because their sleep patterns are not good. Their nutrition patterns are not good. Many of students at a high level in academia, like medical school or PhD, some of them feel like they need to use stimulant drugs like Adderall to study. And then all the pressures of academia, and to get great layers on anxiety disorders. So I see this, and I've met with students personally, and just that the use of the sugar sweetened beverages with the caffeine, and coupled with stimulant drugs, really led to a significant problem that they're now dealing with. And I think maybe they wouldn't have, of course they could use coffee or whatever, but I do think that when people are drinking these sugary beverages, they're not tasting the caffeine. They're tasting the sugar, and that's making them want to have more and more of that. So by the end of the day, they're 800 to 1,000 milligrams of caffeine, on top of other stimulants. So if we could maybe put some labeling on that, even just heard of a friend of mine had to be hospitalized because he had some heart issue that he felt was coming on. And, when they kind of analyzed him and questioned him, it was too many energy drinks was triggering erratic heartbeat. So I think that should be like a big focus on campaigns for overall wellness. I'm sure Rick Johnson, if you had him here, he would totally agree too, as we just did an interview. And there was a lot of disagreement maybe or debate in the interview, but one thing everybody agreed upon was that the biggest thing we have to target or minimize would be sugar sweetened beverages, in particular the ones that are, the high caffeine energy drinks.
Yeah, it's a really good point that without understanding the long-term implications of certain choices that we make today, it really does have downstream consequences, and it's something that Chris Palmer's brought up a lot in his research, and I'm sure you're very familiar with around dietary interventions that can drastically change people's current reliance on some medications when it comes to mental health. The research is showing that you can do this over time, and so the earlier we can get this, it's unfortunate, but I think the default right now, especially with young kids, you see very young kids that are getting diagnosed with things like ADHD. And do they have ADHD to the point where they need some kind of medical intervention and they start taking some prescription drug? Or is it that they're staying up till, let's say a kid it doesn't matter the age, but a kid who's 7 or 8 years old and they're maybe on an iPad till 10:30 at night and they're eating goldfish for dinner and they're not getting exercise, and you go, wait, we can mitigate all of this and their behavior drastically changes. It's that compounds from that early age, and those become these ingrained habits and behaviors that we carry on throughout life. And so that's where, and then people get into their 30s, 40s, 50s, 60s, and you go, how did that happen? And it's like, well, remember that when you were supposed to be watching Scooby-Doo and having an apple and or maybe running around outside and whatever, and instead you're on the iPad and you're playing Roblox and you're eating goldfish and drinking a Frappuccino? Yeah, that's the reason why we've got to this point in life where there are some of these chronic conditions in it, and people can take that health into their own hands. But I think the point you bring up around just giving people that foundational insight to say, get rid of the things like the sugary drinks, get rid of the highly processed food, start creating habits that are healthy around things like sleep, good sleep hygiene, good exercise. And that doesn't mean that people need this vigorous exercise 7 days a week. 20 minutes of walking is better than, to use sort of Gary Vee's old adage, is like a 1 is better than a 0. Objectively, a 1 is better than a 0. And so just making sure that people are starting these incremental habits to build a good foundation makes a big difference in life.
Yeah, that is. You had mentioned Roblox, and I think, that's a great, I've never played it, but it's a good mind game and requires like sort of attention. But I want to sort of mention Jan and David Baszucki. So, and the Baszucki Brain Research Foundation, Chris Palmer is a big part of that as they help Matt Baszucki with managing his bipolar disorder. And I think they are really spearheading the field of metabolic psychiatry and this understanding that, our food directly impacts our mental state and our mental health. And that's such an important message because, I had no less than 2, maybe 3 conversations this week with people that were struggling, or families struggling with mental health crises, where dietary interventions were were helping when other things did not, when medical, medication was not helping. One thing that I kind of wanted to mention is that I do think in some cases the medication has caused the problem. For example, for ADHD or other disorders like maybe stimulant medications, or where people feel overwhelmed, everybody's trying to manage so many different things with their, especially hard charging people in their career. What's called the allostatic load is very high. They're very task loaded, and that can lead to a high general state of anxiety. And what I think is a big problem is the benzodiazepine drugs. 10 or 20 years ago, we had the opioid crisis, and that's still going on, right? And that's really bad. But I think what's maybe not talked about as much, and I think equally or just as bad as the opioid, is the prescription benzodiazepine drugs. And these things can be really hard to get off of and can even lead to death from the withdrawal of getting off of them. But I mention that because I've been in correspondence with people who have been able to get off of them, but only in the context of like nutritional ketosis or a dietary intervention, and then gradually weaning them off. And it's balancing brain energy metabolism, balancing the neuropharmacology of the brain in a way, the GABA to glutamate. As we know, the nutritional ketosis sort of activates a greater conversion of glutamate to GABA through an enzyme called glutamic acid decarboxylase. So it helps, and that's sort of linked to its ability to manage seizures like epilepsy. So the same mechanisms are at play with balancing your mood and reducing anxiety. So I think nutrition is a huge lever when it comes to mental health, and we're going to tools that can help us understand how food affects our metabolism are going to be really important tools for doing that intervention clinically, but also from the context of the average person who wants to optimize their mood and their behavior and their enjoyment in life will start to correlate glycemic trends to how they feel. And I think I've been able to do that, and I think it plays a big part in just managing my overall mental well-being, and it gives you that metabolic insight. As my students say, metabolic wokeness, metabolic awareness. We're entering an exciting age where these tools are now available. People can access them without a prescription. The technology, the scaling up, maybe competition in the environment, we're going to make them the price point accessible over time. And I think our tools, the tools that take the data and give actionable insights into that are sort of the more innovative area of technological advancement. And I think this data combined with other biomarkers too is really going to change what would make people much more proactive instead of metabolically reactive when a problem occurs.